Overview of COPD. Hello and welcome to this micro-learning module on the overview of COPD. Before we dive into the topic, let's break down the meaning of COPD, which is an abbreviation for chronic obstructive pulmonary disease. Chronic stands for continuing for a long time. Example, a disease like diabetes. Obstructive, that causes a block such as in airways, breathing tubes, that get narrowed due to smoke that is breathed in for many years. Pulmonary, relating to the lungs, the organ which is responsible for breathing. And disease refers to an unhealthy state where something bad happens to the body or mind. Causes and symptoms of COPD. Chronic obstructive pulmonary disease, or COPD, can develop due to various factors, including smoking tobacco in any form. People who smoke tobacco in any form like cigarettes, bidi, chillum, or hookah for a long period of time, that's several years, often develop COPD. Exposure to indoor or outdoor air pollution. Smoke from wood, animal dung cakes, etc. used in chulha for cooking, smoke from mosquito coils, incense sticks or agarbattis or dhoop, especially in closed rooms with poor ventilation, increases the risk of developing COPD. Prolonged exposure to smoke, dust, or chemicals in the workplace. Long-term exposure to smoke and dust in the workplace, like mining industry, stone cutting industry, building construction, farming, etc., has been shown to cause COPD. Advancing age. COPD develops slowly over years. So COPD due to tobacco usually occurs after 40 years of age when symptoms begin, while COPD due to biomass, smoke exposure, occurs at younger ages, even below 30 years. A history of tuberculosis. Post-TB COPD. People who suffered from TB in the past can develop COPD after a few years, even if they take complete treatment of TB and are cured of it. Pre-existing asthma. Long-standing, poorly treated asthma causes permanent damage to airways, leading to development of COPD. But what really happens in the lungs of a patient with COPD? When the smoke particles and dust that a person breathes in gets deposited in the airways over a long period of time, the airways and air sacs, that is alveoli, get damaged. The airways become thickened, swollen, and blocked. Excess mucus is produced. Thus, the air sacs break and merge into each other. COPD is a lung disease due to toxic insult of the airways and lung parenchyma to harmful environmental substances. Recognizing the symptoms of COPD. Now that we've explored the causes, let's take a look at the symptoms. COPD often presents as a persistent cough lasting for an extended period. Long-standing cough usually lasts for more than 6 months. Cough may be with or without sputum, mostly early morning with phlegm, but occurs throughout the day. Excessive mucus or sputum production. Difficulty in breathing. This is seen in the form of shortness of breath, especially on exertion, even simple forms of exertion. Wheezing is seen in the form of whistling sound coming from the chest, especially while breathing out. And chest tightness or heaviness of chest. As the disease progresses, more severe symptoms may appear in the later stages, such as bluish discoloration of the lips and nail beds, frequent respiratory or chest infections, chronic fatigue and difficulty in carrying out daily activities, swelling in the feet and ankles, and unintended weight loss in advanced stages. Usually, patients of COPD also have other diseases like high blood pressure, heart diseases, muscle weakness and pain, weakened bones, depression, and diabetes. Recognizing these symptoms early can help in better management and improved quality of life. Diagnosis. Let's take a look at how COPD can be diagnosed and treated. The diagnosis of COPD is done by a test called as spirometry. It is a machine in which one has to blow out forcefully for about 15 seconds. The machine gives us a report which shows whether there is a blockage of the airways, how severe it is, and whether the blockage is reversible with inhaled medicines which open up the airways, like salbutamol. In COPD, the airways usually do not open after giving a bronchodilator, whereas asthma shows a good response, so that the spirometry values improve. Poor response to bronchodilator medicines is usually the confirmatory diagnosis of COPD. Treatment of COPD. Let's move ahead and look at the treatment that a COPD patient needs to undergo. Reducing further exposure to smoke and poisonous gases. The following precautions should be taken. Stop tobacco smoking immediately. People who smoke tobacco in any form, like cigarettes, bidi, chillum, or hookah for a long period of time or several years, often develop COPD. Stop exposure to biomass fuel smoke. Use clean fuels like LPG or solar cooker or biogas fuel or electricity, and ensure proper ventilation in the kitchen. Use masks. If the patient is in an occupation which exposes them to smoke, dust, particulate matter, use a mask. Change the occupation if possible. Stop indoor air pollution. Mosquito nets are a good alternative to protect oneself from mosquito menace, which help in minimizing indoor smoke. The solution to these can be in the form of improving kitchen ventilation by having a chimney, using an exhaust fan, usage of low smoke chula, replacing biomass with LPG, and usage of electric and solar cooking stoves. Giving medicines that open up the airways like LABA and LAMA. Since COPD is a disease that blocks the airways, opening the airways is the only way to treat COPD. There are medicines which open choked airways. The best treatment for COPD is to give these medicines directly into the lungs using inhalers. The inhaled medicine opens the airways by removing the blockage, making it easier to breathe. Medicines cannot reverse the damage that has already been done to the lungs, but they can decrease breathlessness and improve the quality of life of the patients. Regular exercise for COPD patients. Simple exercises are extremely important for COPD patients. Exercise helps their body use oxygen better. The key is to do it, but not to overdo it. Benefits include strengthening the heart, lowering blood pressure, and improving energy, helping maintain a healthy weight. Here are a few exercises that can be done by COPD patients. Diaphragmatic breathing. It is a deep breathing technique that strengthens the diaphragm and improves oxygen intake. Pursed lip breathing. This is done by taking a deep breath in through the nose and while exhaling, purse the lips into a round so that air comes out slowly over a few seconds. This helps the patients breathe out more air so that they can breathe in more air during the next breath. Walking. It is a very effective and essential exercise for the patients. They can start with small steps and shorter distance initially, and then gradually increase the distance. Simple arm and leg exercises. COPD patients develop a lot of weakness in their limbs, and exercises to strengthen the arms and legs are very important. It could be as simple as raising of arms and legs while standing and lying down position. Abdominal breathing. In this exercise, make the patient lie down with one hand on the chest and the other on the abdomen to feel the movements of the chest and abdomen. Ask the patient to breathe in deeply in a way that the abdomen expands and comes out. The patient should take the abdomen in while breathing out. This can be done in a standing position also. Upper and lower limb exercises. It improves muscle strength, mobility, and overall endurance for better daily functioning. Proper nutrition. Proper nutrition is crucial for COPD patients and includes drinking plenty of water, having a protein-rich diet consisting of milk, eggs, meat, antioxidant-rich diet which includes leafy vegetables, colored fruits, broccoli, cauliflower, cabbage, papaya, and apple. Vaccination. COPD patients are prone to infections due to weakened lungs. Every infection can reduce the capacity of their lung without coming back to the pre-exacerbation status. Hence, repeated infections can lead to an accelerated decline of their lung function and can lead to an earlier death as compared to those who do not receive the vaccination. Patients should receive the flu vaccine annually, pneumococcal vaccine once in the lifetime if they are over 65 years old, DPT vaccine, herpes or shingles, COVID vaccine. The following vaccines must be taken by COPD patients: flu vaccine every year, pneumococcal vaccine one time, DPT once, booster dose, herpes simplex once, booster dose, COVID vaccine regular plus booster doses as and when recommended. Importance of counseling COPD patients. Now that we have understood the treatment required for COPD, let's take a look at how essential counseling is for COPD patients. Since COPD is a chronic disease, patients need to be on treatment for the rest of their lives. Only pharmacotherapy will not help the patient. Despite the best possible pharmacotherapy, the patient will continue to have symptoms. Therefore, counseling is the only way to ensure that patient continues treatment, and we as healthcare providers can improve the quality of life of the COPD patients. Before we end this module, let's take a look at what we have covered so far. What is COPD? Identifying the various triggers and symptoms of COPD. Diagnosis of COPD. The key treatments essential for COPD patients. And importance of counseling COPD patients. With this, we have reached the end of this module. We hope this module provided an insight into the world of COPD and its treatments. Remember to manage your COPD patients well to bring back the colors in their lives. Happy learning!